Hi everyone, I'm Dr. Sach Mohan. It's my first time in Islamabad, so big salam to you all. It's my second time in Pakistan, and the first time I came to Karachi, met the whole team here, and it's so good to be back. So you can automatically, from my name, understand that I'm of Indian heritage. So the talk that I'm giving and the importance that I'm giving it to you must be even more fold for you because look, I'm sacrificing watching India in the World Cup final to talk to you guys. Okay? But one thing is for sure, as soon as my talk is over, I'm out of here. Okay, so now I have to be completely honest with you. Ahmed is one of my dearest friends, okay? And he and I always challenge each other. And today we're going to do exactly the same. So I want you to draw upon everything that Ahmed has already discussed in his talk, particularly when it comes to the fat compartments of the face. Now, Indian heritage, but born and bred in London. I've been taught by all of the greatest injectors around, and I like to do things different. I've been very lucky. I've had all of India's biggest industrialists, or all of the Bollywood stars, or the Hollywood stars as my patients. I run one of the most high-end exclusive clinics in the world. And as a result, I've also had the privilege of being able to treat every single kind of face that there is. And what I'm saying to you today is energy devices. I've used lots of energy devices. In my clinic alone, I have evaluated over 40 devices in the clinic of every single type. And what I'm about to say is going to be slightly provocative. It might raise a few eyebrows, but that's what we're here to do. Now, the title is Morpheus 8 more important than fillers and threads in your aesthetic practice? And why is that exclusively for the Asian subcontinent? So, we need to go back. We need to go back as to why do we have these devices? And what do these devices do? Whether those are threads, whether those are fillers, whether those are energy devices. Why is the knowledge of our deep and superficial fat compartments so important? And why are they so important here in Asia? And what do I do? What do I do in my practice that I could impart on you guys, that I can help you with in your practice? And how I've gone on to use Morpheus and Vicross. Now, Vicross is the Allergan range of hyaluronic acid fillers, not widely used here in Pakistan, but we'll talk about that. Now, I'm going to interchange with a little bit of Urdu and English because I don't get the opportunity to do that in any other sphere. So, I'm going to try and use my bilingual tongue as much as possible. Magar dekha jaye, the one thing which is uniform across this room amongst the men and the women here is that your faces are not aging like a Caucasian face. Okay? The morphology of our skulls is very different to that of a Caucasian face. Jo aapko sikhaya gaya hai about hyaluronic acid and the use of fillers and the use of biostimulators is primarily geared for a Caucasian face. Hamare chehron ke liye nahi hai. Okay? And this is a very, very important thing for you to just bear in mind. You have been taught to inject and assess a face based on Western needs and how their faces change. They get facial atrophy. They get facial atrophy when they age. They develop skin elastosis when they age. But that elastosis, yes, applies to us as well. But the other thing is that we don't generally get atrophy. We get hypertrophy. हमारे चेहरे फूल जाते हैं. Because guess what? We're of that generation where as we age, we gain weight. When we gain weight, that weight appears in our face as well. So the concept that everything can be addressed by volumization is wrong. So agar dekha jaye, right? If you've got a jowl, ठीक है? The latak that you get there in the mandibular border. What do they teach you? They say camouflage it. Enhance the jawline, volumize the jawline, stretch it out as much as possible. But is that what we should be doing here? When we already know that our fat compartments are growing, should we be adding more volume to camouflage it? Is that what we should be doing? I don't think so. And then the other thing is that, look, most of our weight is in the lower third of the face, okay? It's either in the men, it's the double chin. In the women, it's the jowls, okay? And it's the lower third of the face which grows with age. But the problem is that we're then thinking about, okay, we've got to maintain this V shape. You know, okay, we've got to maintain the V shape. Ye karna hai. But if the lower face is already grown out, then you're going to hypercompensate for it by adding more to the malar face? I don't think so. That's why fillers look so fake, because we're having to add so much to compensate. And we shouldn't be doing that. At the end of the day, we are medics. Our job is to make a diagnosis and treat the root cause wherever possible. We're not in the business of camouflage. So, now, these are the things that Dr. Ahmed's busy, but the one thing that you also need to bear in mind is that there is a second school of thought. I'm not here to say to you guys that, look, follow what I'm saying. I'm just saying appreciate that there could be an alternative perspective. And the alternative perspective is here. In 2007, Lambros analyzed 130 subjects, photographed them between 10 and 56 years apart. And what did they find? They found that moles, acne scars, actually gitte nahi hai. They're in the same place. They don't change in this position. So that dropping that you see isn't dropping. That sagging that everyone talks about is not sagging. What it is it's the loss of elasticity. It's the loss of retraction. And this is everything that Ahmed was talking about. We're talking about here on the left side, the deep fat compartments. Okay, now this is the similarity that we do have across the planet. That as we grow older, whether we gain weight or not, we all get atrophy of our deep fat compartments. But the variability is in the superficial ones. The variability comes here, in the nasolabial fat compartments, in the jowls, in the lower third of the face. This is where you now need to pay attention. To say, okay, is aging about isolated fat compartment gain as well? And is that spread now responsible for the look that you get in middle age? Now, this is where Morpheus comes into place. Or, if you look over there, lemon bottle. Yes, I'm paid by Morpheus to be here, but nah, as far as I'm concerned, I'm here to help you in your practice. Now, I use Morpheus to restore the natural volume and the volume compartments in your face. So when I'm analyzing someone's face, the first thing that I do is I analyze every fat compartment. And I look to see which one of the fat compartments have gained volume and which one of those fat compartments have you lost volume. Then it's then all about addressing those compartments where you've gained volume, and then understanding, is that gain responsible for the sagging? And can the reduction of that volume be responsible for helping your patients look younger? It's something to really think about. So, Morpheus is around. I've heard other technologies being discussed, Silfirm. I've heard about Scarlett as well. These are the most common microneedling devices that I've seen discussed in Pakistan. But the one thing that you have to bear in mind is that the other two brands describe and try and scare people about Morpheus because they say, Hai Rabbah, you melt fat with Morpheus, it's too strong. But guess what? That's its strength. That's precisely what it's meant to do. It's a subdermal adipose remodeling device. It lets you perform lipolysis on your patients, and the heat that's generated melts the fat. And when it melts the fat, guess what? You've also got heat shock proteins which are stimulating all of the reticular system. Now you all remember Ahmed's picture from before where he showed the tree of ligaments from the fibrous septae that runs through the fat all the way through the SMAS into those retaining ligaments. It's precisely that fibrous septae that once the microneedles are entering the subcutaneous region, entering the fat, not only is it melting the fat, but it's stimulating and causing a contracture in the fibrous septae. But what does that mean for your patient? Okay? Your patients are coming to you wanting this, asking for this. But strictly speaking, that's not what it's giving you. What it's actually giving you is a retraction. It's helping pull the skin back down. So when you're talking to your patients about RF microneedling, it doesn't matter which device you're talking about. Don't describe lifting. Describe retraction. So you say to your patient, I'm going to help this, the pull away that you're now experiencing. The tightening feeling that the patient feels like a lift, but it's not a lift, it's a retraction. So the Morpheus itself has the ability, number one, it's got deeper needles. The Morpheus device allows needles to go to 4 millimeters. And once it's at 4 millimeters, you can safely say in the face, it's in the fat. Okay? Now, when it's doing it, it's able to do it because it's got, I'm going to go back one. I'm going to go back one, if it lets me. It's got, the most important thing is, I'll show you on the next one, is the fact that the needles are insulated. So no matter what you're treating, you can do 1 millimeter treatments, you can do 0.5 millimeter treatments, you can go 2, 3, and with the body tips you can go all the way down to 7 millimeters, which means you can treat as deep down as you want, which gives you the option to treat the body as well. But you've then got the fact that the actual needles themselves are highly insulated. Okay? The difference is here is that insulation is protecting your dermis and epidermis. Okay? So you're able to hit those 70 degrees deep down in the fat, melt it, but still preserving your epidermis at the same time. Other competitive devices aren't necessarily insulated, and if they are insulated, don't have the needle depth to enter the fat either. But then you also then need to talk about how high do I turn the energy, because at the end of the day, if you are down if you're down to 4 millimeters, you can still create enough energy that can rise to the surface, and that's where the needle spacing comes in. When you turn the energies up, you're covering up to 16.4% of the surface area. But when the energy levels are slightly lower, you don't get the spread of heat coming upwards, and the area coverage is less. So when you're treating skin, you have to use more shots and more overlap. When you're treating fat, you don't necessarily need to do as much, but the total energy that you're delivering needs to increase anyway. And this is a nice photograph for you all to take, because this will enable you to explain to your patients, when you make your investment in Morpheus, what is it that makes it different, and why you are now embracing the adipose remodeling, because you're going to give them the youthful looks again by giving them the cheekbone definition, by giving them the jawline definition they once had, by reducing that overload in those fat compartments. So, 24 pins, advanced lattice. So the thing about the Morpheus is also, which is unique, is that it allows global heating throughout. So whilst you may think that you're just treating the fat when you're at 4 millimeters, it's unlike any other device, because the patent technology here isn't about the current itself passing between the needles. The return electrode, when you're looking at a Morpheus, is actually the whole plate, the surface plate. So the impedance that it meets creates the current and generates the heat that then rises up to the surface. But beyond Morpheus, there are other devices. There are other handpieces. So if you look all the way onto the far end, you see you can go down to 7 millimeters, which is really good because you can then treat larger areas and onto the body, where you can do a treble stack, where you can do 7, 5, 3 millimeters, which works really, really well. And then also remember, you have control. So whilst, yes, I said there's no problem for you to use liquid lipolysis of any kind, the good thing about Morpheus is that it's controlled, because you know that you're only going to be able to cause lipolysis in roughly 1.5 millimeter depth of fat. And if you're unsure of how much your patient needs, just bear that in mind. For those of you that do have an ultrasound, and I will have to disagree with my esteemed colleague, I think every practice needs an ultrasound device if you are performing these kind of treatments. And there you have it. That's just showing you the depth at which you can go. There is a resurfacing device as well for those that just want to perform skin rejuvenation, which only stays within the epidermis. So that's, again, one of my other things, which is really important to say, is that whenever you're using RF microneedling, think of it as a deep peel, in that there is a risk of PIH as well. And when you're managing your patient and priming your patient, their skin needs to be prepped. So whether that's with a mild ascorbic acid, I don't mind. But my strong recommendation always is that you also prime your patient to reduce the risk of PIH. And so what does it all mean in the practice? Trust. Here you are embracing lipolysis. You're saying to your patients, yes, I have invested in the best microneedling system, which does exactly the same as a Silfirm, does exactly the same as a Scarlett, but it does more. I can now really contour your face and reduce the excess fullness. But it's all about pain management as well. So remember, you're causing lipolysis. And lipolysis can't happen without adequate pain control. For those of you that have been following me on Instagram, and my Instagram is listed at the very end, you'll see that we do nerve blocks. Topical anesthesia isn't enough when you're wanting to perform thermal lipolysis. So I'll just describe that for you now. Let me see. Could you play the video on my laptop? Just press play. That's it. Thank you. Can you turn the sound up? Okay, so this time it's one of our patients who's a dentist, and this is her third treatment. And she's in love with the results. And what she's also in love with is our pain management techniques. So she's saying yes. So as a dentist, she places numbing injections all the time. But if you're looking carefully, you'll be able to see some of the red marks. You can see there's a zygomatic nerve block there. There's a auricular one as well. But we'll move on to the next video, because the next video will demonstrate how I perform those nerve blocks as well. Could you play this as well, please? Okay, so this is the infraorbital. Point 1. Point 2 is the mental. Point 3 is some of the aberrant buccal branches coming through. Point 4, now we're looking at the auricular temporal. Zygomatic. So this one's actually measured by actually using one finger breadth from the lateral canthus, and then another finger breadth or 2 finger breadths down, depending on the size of the patient. And the final one is the cervical branches. So you're asking the patient to raise their head, turn to the side, and you'll see the posterior border. You see the posterior border of the sternocleidomastoid, and you run it just under the skin behind it. That gives a total numbing experience, which, you know, whether you're using Morpheus or not, this is a great skill set. So, what does it mean? What does it mean in my practice? Now, I'm going back to Carvel. I said to you that this is how my practice has changed. Here she is before, 36 years old, looking now 40. But you can see now the demarcation of those fat compartments now coming through. I personally think that she's not a candidate for threads. I don't like threads. But there is the hypertrophy coming through. We did one session Morpheus, and that has literally brought down that fat compartment. And then what we have done is that we've addressed where she has lost volume. So a little bit of hyaluronic acid just in the tear trough, and just a little bit just above, just underneath the orbicularis oris. Again, another nice example where you can see the little bit of sagging that's happening along the jawline, that ill definition. And this is where we're talking about just using the device at 3 millimeters just to cause that strengthening of the basement membrane, just to tighten and retract the skin slightly. But this is pure lipolysis. Okay? So what would you normally do in your practice? Yeah? This guy has gained weight as he has got older. What are you going to do? Are you really going to put more hyaluronic acid along his jawline? Or use a radius or whatever else you do in your practice? No. It doesn't make sense to do that. Get rid of the fat. And you can do that non-surgically. And then people talk about how dangerous it is. Here you have the thinnest skin in a skin type, in a Fitzpatrick 1. One session at 2 millimeters enters the fat, and literally this is only 6 or 7 shots, and it's basically treated the infraorbital hypertrophy of the fat. This is another great case study. This is just a unilateral enlargement of the nasolabial fat compartment. So again, you know, just to give her a little bit of symmetry, what would you have done? You know, would you mask that? Would you camouflage that with fillers? I don't think so. Treat the root cause. And then the beauty is that you're not just limited to the face. You can use this across the body because, as I said, it basically remodels all the fibroseptae. It causes a nice lipolysis of the very, very superficial fat layers, and it can even out cellulite as well. Tightening of the skin. There you go. There's a nice example of where you don't necessarily need the Morpheus for lipolysis. You wouldn't use it necessarily here, but it's really good for skin retraction as well.